Hi, Dr. Yass here. In this video, I want to talk about the mechanics of how you obtain the Yass method because I specifically want to dig into the costs associated with getting the Yass method. I will tell you straight out that you will never have your pain or other symptoms resolved without getting a proper diagnosis, which means that you need some mechanism that allows for a proper diagnosis to be achieved. And we already know, and I don't need to go into it any further, that the MRI is baseless. So the only true way is through the interpretation of the symptoms being experienced because those symptoms are being elicited by the tissue in distress. That's how you find it and resolve the distress of that tissue once identified. The Yass method, as far as I know, is the only method that has a diagnostic component to it in which there is an interpretation of the body's presentation of symptoms, which is part of the evaluative technique, which occurs during the beginning portion of a Yass method Zoom session. So you get the right diagnosis in more than 98% of cases. The cause is muscular, regardless of whether it's a muscle eliciting a symptom or causing another muscle to compensate, whether it's you're having pain in a joint due to misalignment of the joint surfaces because there's some sort of weakness or imbalance of the muscles that attach to the joint. Muscles can refer symptoms, which is the equivalent of when someone wakes up with numbness in their hand after sleeping on their shoulder. That has nothing to do with the cervical spine or nerve roots. It's actually the infraspinatus portion of the rotator cuff referring symptoms. Literally, the muscle is sending the signal down to the hand. And finally, muscles can strain and impinge on nerves, which is what sciatica it is. Sciatica has nothing to do with the lumbar spine. It's due to hip dysfunction, which finally leads to the piriformis muscle impinging on the sciatic nerve, a muscular cause creating neurological symptom. Those four mechanisms account for 98 to 99% of all cases of pain globally, the 1 billion people. So the Yass method gives you the ability to get the right diagnosis. Then, when in fact it is confirmed to be muscular, you have the ability to understand which particular muscles and then understand how to perform the appropriate isolated strength training exercises, which allow you to be in a stable situation and allow the muscle to work by simply moving one joint in one direction, which is what muscles do, and then applying the appropriate progressive resistance, causing the muscle to adapt to greater and greater resistances. And that allows the force output of the muscle to eventually be greater than the force requirement of your activities. And that's how you are pain free and fully functional. Okay. So that's what the Yass method gives you. And in terms of the resistance, the vast majority of people don't go to gyms. We simply use a resistance band, a chair, a door, and a frame. That's all you need for a Zoom session. And that's typically the vast majority of people. That's what they're using. And that's the mechanism to create the resistance that allows them to become pain free and fully functional. And clearly, that could be done in your home or even if you're traveling at a hotel or wherever you are. Okay. So we want to now talk about the mechanism of payment. So the Zoom session costs $200. So you say, oh my God, that sounds like a kind of a lot of money for one session. And, I can go to physical therapy and get some treatment there for 40 or $50 a session. Right. So it sounds like that's a better deal. But what you're not understanding is the way that the system is employed through these Yass Method Zoom sessions. When you get your first Yass Method Zoom session, that session is videotaped. You must understand that everything that's happening is videotaped. From the moment we start that session, I hit record. And the entire, everything we're talking about, everything you do, everything I do is videotaped. So, in terms of the diagnostics, you get to go back over and over and over again and make sure you're understanding what I'm telling you about how I determine that the cause is muscle and which muscles are responsible, right? Then when it comes down to the part of doing the exercise, right? So I'm going to demonstrate the exercise and then you're going to perform it under my supervision. So under this one-on-one setup, the accuracy that I'm seeking in performing these exercises, so we are in fact isolating the muscles necessary and applying the appropriate resistance so you can get your results as quickly as possible. This is all happening by videotape. So as you're doing those exercises, I'm giving you feedback, making sure you're doing it accurately. That's being videotaped. So at the end of that first session, which I expect for everybody, that they will say that there's some reduction in symptom and improvement in function, if not all elimination of symptom and complete return to function. Some aspect of that is going to happen. So we know that we address the tissue in distress and perform some intervention, or else we wouldn't have seen this reduction in symptom and improvement in function. So this whole thing has been videotaped. The next day, I send you that videotape. So for the next 12 visits or 12 sessions that you're going to perform these exercises, which is 3 times a week for 4 weeks, you're going to utilize the videotape. So it's not like we do the session and then for the next 11 times, you're on your own praying that you remember how to do it, right? Or that you took good notes. There's none of that. You have the videotape. So what you're going to do is you're going to listen to me explain how to perform the exercise. Then you're going to watch yourself perform the exercise with the cues I'm providing you. Then you're going to stop it. You're going to go back. And then on the 2nd through 12th time, you're going to do the exercise to you doing the exercise correctly under my supervision. So you're getting 12 visits with my supervision, watching every single thing you do, maximizing the level of accuracy in performing the exercise, making sure you're getting the most out of it. If you got some level of improvement on the first visit, imagine where you'll be by the 12th time doing it, especially if you progress your resistance 1 or 2 times. You clearly have made your muscle stronger. Therefore, there has to be an improvement in function and a reduction in symptom. So you really, when you're paying that $200, you're not getting 1 session from it. You're getting 12 sessions, which means that the cost of a session is really $18 a session. That's substantially less than the $40 or $50 you would pay every time you go to the physical therapist. Tell me what the level of supervision is when you go for treatment anywhere. Is someone literally standing over you, making sure you're doing it exactly correct? Do you think that they understand even how to do it correctly, let alone be able to supervise you to do it correctly? Do they understand the idea of growing muscle through progressive resistance? All these things are factors, right? So every time you leave a treatment, how much closer are you in terms of your understanding of what is necessary to do, your ability to develop the strength to resolve your symptoms, improve your functionality, and eventually sustain it from reoccurring? How close are you? You're not. You're not. Because anywhere you go, nobody is giving you direct one-on-one, 100% of the time supervision. That's what you get when you get that Yass Method Zoom session. That is videotaped. Therefore, every single time after it, you are following the exact cues and supervision that I have provided. You are doing it exactly each time from the 2nd to the 12th time that you did it the first time. You can't beat that level of supervision. And as I said, that is an equivalent of $18 a session. Now, what happens is about on the 24th day after the first session, you will get an email recommending or asking you to make a follow-up visit. So you're going to get your follow-up visit on your 13th visit, the 4-week follow-up visit. Now we're going to check and see where you are. We're going to make sure everything is going as it should be. We're going to make sure that you're doing the exercises as accurately as they can be done to make sure that you get the most out of it. I'm going to make sure that you're progressing the resistance appropriately. So we're going to make sure that everything is being done in the way it should and that you're seeing a progression in a reasonable fashion. For any type of treatment you've gotten outside of this where it's 6 to 8 months and you're no better and the person's telling you, oh, just keep going, it takes longer, that's insanity. There should be some sort of cumulative progression if you are treating the right tissue, right? So this is the understanding. This is the mechanism that the Yass method works. I did it this way because my opinion is that what a person needs when they're having symptoms is they need to get the right diagnosis. They need to confirm whether it's structural or muscular. If it's muscular, they have to be shown which muscles it is, how to perform the proper exercises, and then how to use appropriate resistance. From that point on, as long as there's some guiding principles, it has to be up to the individual to perform the exercises to achieve their goals. I can't make you stronger, only you can make you stronger. So, by providing you this high level of supervision and understanding that occurs in the first visit, that's what you get to use going forward for the next 11 visits. Then, of course, we need to have some sort of follow up to make sure everything is going appropriately and that you're doing things exactly, because there is the opportunity for interpretation. I mean, that's human, that's the way it works. So, I want to make sure everything is continuing on. So, that's when you get that 4-week follow-up visit. Now that visit becomes videotape. After that 13th visit, that 13th time you've done your exercise, that videotape supplants the first videotape, and this becomes the videotape you use. So you're constantly improving your understanding, improving your accuracy, improving your ability to achieve your goal of becoming pain-free and fully functional. And if you recognize that although you're paying for one visit, it really accounts for 12 visits, then you recognize that the course is actually broken down through 12 visits. So literally, it is the equivalent of $18 a session every time you perform your exercises to resolve your pain. That's what you get when you get a Yass Method Zoom session. So if this sounds like it's something interesting to you, and you'd like to contact me, you can do so by email at drmitch@mitchellyass.com. If you'd like to make a Zoom session, Yass Method Zoom session, you could go to my website, livewithoutpains.com/sessions, and that will give you the opportunity. All this will be in the description. That will give you the opportunity to learn about the sessions, to see how they work, and when you're ready to be able to schedule a session for yourself at the day and time that's most convenient for you. If you like this video, please give it a thumbs up. If you like my YouTube channel, Dr. Mitchell Yass, please subscribe to get notifications when new videos are added. I want people to understand not only is the Yass method the only true method to properly get a diagnosis and treatment, but I want you to understand it's extremely cost effective. It is actually the most cost effective means of getting the results you're looking for by getting the appropriate understanding and treatment model to allow you to establish the cause of your symptoms, resolve the cause of your symptoms, thereby preventing the symptoms from being elicited so you become pain-free, fully functional, and most empowering, you have the ability to prevent this from reoccurring. Please get a Yass Method Zoom session. You will see after that first session, it was the best decision you've ever made in terms of finally reclaiming your life and living the life you so justly deserve. For now, this is Dr. Mitchell Yass wishing you a pain-free, fully functional life. Bye-bye for now.